PRP hair restoration versus minoxidil versus a hair transplant. When it comes to treating hair loss, PRP, minoxidil, and hair transplants are three of the most commonly discussed options, each offering distinct approaches, benefits, and limitations. PRP therapy is a non-surgical, natural treatment that uses your own blood to stimulate hair follicles. The treatment involves injecting concentrated platelets into the scalp, where they promote hair follicle regeneration and improve blood circulation. It's a minimally invasive procedure that doesn't require any significant recovery time. PRP works best for individuals in the early to moderate stages of hair loss and requires multiple sessions for optimal results. On average, 3 to 4 treatments are required, followed by occasional maintenance. While PRP can significantly improve hair density, it is not a permanent cure and requires ongoing sessions to maintain results. Minoxidil, on the other hand, is an over-the-counter topical medication applied directly to the scalp. It works by increasing blood flow to the hair follicles and prolonging the growth phase of hair. While it's a more affordable and convenient option, minoxidil typically offers modest results and works better for mild to moderate hair thinning. It also requires continuous use to maintain results, and some users experience side effects like scalp irritation or dryness. Unlike PRP, minoxidil may not work well for everyone, and its effectiveness can plateau over time. For advanced cases of hair loss, hair transplants are often considered the most effective solution. In a transplant, healthy hair follicles are moved from areas of dense hair growth, often the back of the head, thinning or bald areas. The results can be permanent, with transplanted hair growing naturally and blending seamlessly with existing hair. However, this option is invasive, requiring surgery, a recovery period, and a significantly higher cost compared to PRP or minoxidil. It's best suited for individuals with significant hair loss who are looking for a long-term solution. Each treatment has its own set of pros and cons, and the right choice depends on the stage of hair loss, budget, and personal preferences. While PRP and minoxidil are non-invasive and require regular maintenance, hair transplants offer a permanent solution but come with a more significant time and financial investment. A consultation with a medical professional can help you decide which treatment is best suited for your unique situation.